About dry eye.
Yeah.
People will complain that I have a red eye, I have a gritty feeling in the eyes, and it's all the time. It doesn't matter what. But it is a common thing, and it is something to do with aging.
Yeah.
And also has a more common in the female, and it has something to do with a lack of androgen. Some of the disease like diabetes, Parkinson, Sjogren's syndrome is autoimmune disease.
Yeah.
All can make you dry eye and giving the same complaint. But treatment is completely different. People who wears contact lens tends to have drier eyes, and they also complain of this. Sometimes we use antihistamine. That is actually a no-no. People who have antihistamine use, they tend to have more dry eye, not less. And there is estrogen, amiodarone is a heart medication, and a lot of depression medicine can do that, right? Usually the common medicine like Zoloft, Prozac, even that can cause dry eye. Medication that we put in eyes with a preservatives, that is known to do drying of the eye. So if that happens, please don't use eye drops which has preservatives. You may use some eye drops that doesn't have, that would be okay, natural tear. And you have a vitamin A deficiency, which is not common, but it happens. And also low humidity. It means in winter you may have more issue with the eyes than in the summer.
And that is the important thing.
Yes.
Because so eye has different portions, and for audience to understand that, so we are talking about the white portion is sclera, and then you see the black portion which has cornea. So those, and then there is a shutter inside it. So that, and then there's a lens behind it, and then there are of course the gel portion and the retina, so which sends all these neurons signals to the part of brain. So also for audience to understand that vision is very complicated in that sense that different colors are appreciated, and there is a part of the retina which will detect at night, and then there is a part which detects daylight or more sharp portions. So the portions in the retina which are which would detect actually your maximum part of the vision, and as well as so the periphery and the central part. So those are different diseases. Now many diseases can affect retina, and most common is diabetes. So if it's not controlled, then unfortunately you can have retinopathy, and that is a serious condition. Also for everybody to know is get your eyes checked every year. So it is very important that don't ignore it. You need to see an eye doctor or optometrist, or at least your primary care. And like Dr. Jamil said, there are parts they can run the vision test and just have you calibrate that whether you lost certain portions or not. Whether it's a near vision or far vision loss is called myopia, very common. And those are very important to know that which part is being affected. And with age, like he mentioned, you can lose the ability to read very close by, and then you can end up with unfortunate cheater glasses or those. Certain things very common are medications. Number one, it's always important. A lot of people buy these medications, especially I see with Benadryl, which is antihistamine, and they will keep taking that at night, and that will dry their eyes, and that has this bad effect on it, so they don't realize that.
Yes. So two ways you can actually have a dry eye. One is your eye is not producing enough tear, or you're losing too much.
Yeah.
These diseases and things like the medicine, that's how they work.
They work. Yeah.
And normally they will come with complaint that red eye and the gritty sensation and blurring, and also burning sensation, and surprisingly some people complain of excessive tear. Yeah. There's also sign of dryness of the eye, but hard to believe. So when you see the doctor, they'll make sure that you don't have any infection or inflammation causing these problems. If it is not, treatment is simple. It is like an artificial tear and warm compress.
Wow.
So it is good thing to know what kind. Once you rule out bad diseases like a diabetes, Parkinson's, or a Sjogren's syndrome, there are a lot of series of diseases that come dryness of the eyes. Then treatment is simple. You have to be on this medicine, and it's not going to hurt your eyes. Next common thing they come up with is a cataract,
Yeah.
which is very common. And we all know that somebody has a cataract operation. As Dr. Moby was telling, that eye is like a camera. It has a shutter, it has a lens, it has a back of the eye which captures the picture. Problem with the cataract is that it's a problem with the lens. And it is there's a Latin word, cataract. It means waterfall. Before we have the treatment of cataract with surgery and taking of the cataract out, used to see people with a cataract completely white area in front of the eyes, the people. They look like a waterfall. Or nowadays it is not that common. In the United States, only 12% people will go blind from the cataract, compared to 47% in developing country. So it is a very serious problem, which is almost curable. So, can we do anything to slow down cataract? Yes, we can. Actually, if you stop smoking, stop alcohol use, and cut down the sun exposure, wear a sunglass going out, diabetes mellitus, practicing safe sex so that you don't get HIV. HIV can cause cataract. And also issue the nutrition and also steroid use. One thing we cannot change is age. We all probably going to get a cataract as we get older, but we can slow down as much as possible before that happens. Treatment, as I told you, that's simple. Cataract is 95% success rate. So doctor will tell you that you have to go for surgery, and you can safely go there, and they will explain what kind of lens you need, what kind of complication you can get, and if you agree to those, then they will do the surgery. For operation, you don't need any investigation. Almost anybody can go for surgery. And only thing that you cannot have when you go for surgery, that cough. If you have a cough, they will not do the surgery because it's a delicate operation, and you don't mess it up when you're coughing and cutting something into where you don't need to.
Yeah.
And even if you have a mechanical valve, we used to give antibiotics and things before surgery. For cataract operation, you don't need any antibiotics. Even if you're on aspirin, you can still go on. But you still, if you are higher level of anticoagulation, like Coumadin, probably they will check your blood test to make sure the blood is not too thin. Other than that, it is pretty safe. And most of the people who have a cataract operation tends to go for a second operation as quickly as can because they found so much benefit. They says, my God, I never saw so much light in my life. So it must be a life-changing thing. Next thing is pretty serious. It's called glaucoma. Dr. Moby was talking about seeing the eye doctor. That's one reason you go to see the eye doctor. Not only check your vision, also glaucoma. Because the pressure in your eyeball, if it goes too high, it can cause blindness, which is almost blindness actually. It's a serious cause for blindness in the United States. There is a 75% all blindness in the United States is from glaucoma. And 50% even didn't know that they have glaucoma. So it is important to go at least check your pressure by an optometrist or an ophthalmologist, just to make sure that you're not getting into something which is curable. And it will be shame that if you don't do nothing about it on time. Next thing we all know about is probably macular degeneration, which is common nowadays because people are living longer, and the way people will complain that, I see that person, but I cannot see his face clearly. I read, but I cannot read in the middle. In the periphery, it looks like okay, but I just cannot read it. So slowly that gets even worse, macular degeneration. And ultimately, people go completely blind. There is few things you can do about that too. Like you need to see doctors. They can give a shot in your eyes, and that will stop the blood vessels that tend to kill your vision. And it is not painful, but it is expensive. But most of the time, if you need it, insurance probably will cover.
So those are, very important. Now for cataract, I remember there was a story somebody told me, and it's very interesting, that one of the ladies, most ladies or most older folks would not actually complain. They go into this mode where they could have problem with cataract, and they would just keep quiet. So this lady actually never complained on anything until got cataract surgery done, and after surgery she cried. And doctor asked, "Why did you cry?" She said, "I saw my grandkids first time."
Yes, so it is a life-changing thing, of course. Another thing before I forget about macular degeneration, it runs in the family.
Oh, it.
Yes, so there is a direct relation between smoking and macular degeneration. If somebody thinks that he has a macular degeneration or don't think, nobody should smoke.
Wow.
Because there is nothing good comes out of smoking
Yeah.
other than heart attack. That is not good. And also depends on what type of macular degeneration you have. On that basis, dry and wet.
Yeah.
Wet is actually worse than the dry. So when you see the eye doctor, probably they'll tell you that how aggressively you have to do. They will give you a card with the lines in it, and they'll say, when you see the changing line at the middle, you call me.
Oh.
And so because that is time probably something needs to be done. Next thing is diabetic retinopathy, which is most common.
Yeah.
Like diabetes is very common in our society, so complication is also very common. Anybody who has diabetes for 15 years, you can see some sign of retinopathy by age 15. So it is depends on how many years you have diabetes. When you know you have a sugar problem, probably you had a problem of sugar for at least 5 years before you knew about it.
Yeah.
So anytime you have a diagnosis of diabetes, you go and see your eye doctor. You check your kidneys function, make sure that you're not spilling protein in it, because you had diabetes for a long time, even before you knew it. So that is very important that you check this thing. It's more preventive, and how tighter you control you have sugar, and the better control you will have on your retinopathy in future. If you have a sleep apnea, make sure that you treat sleep apnea, because there is a relation between sleep apnea and diabetic retinopathy. And it is, even if you have a renal failure and on dialysis, you do dialysis because it will help with your retinopathy. So there's few things that you can do other than controlling your blood sugar. Everybody will have a retinopathy at the end, but depends on how bad, whether it will be functional or not. You can give a shot inside the eyes to burn the blood vessels, or they call antivascular, some medication you give to stop the progression of the disease. So something you can do even when you have a bad disease. It's not the end of all, like it used to be probably 50 years ago. Next one is temporal arteritis, which is not as common, but we should keep in mind, because once you lose vision from temporal arteritis, it is gone. It happens suddenly and you're done. Nothing you can do. But you should do more things to prevent the loss on the other eye. That is the aim.
Exactly.
And that's why you need to have the diagnosis.
And for audience, just to understand, temporal arteritis is actually inflammation of the arteries here. And because the arteries which supply to the eyes are part of it, so if there's inflammation in these arteries, it can also cause inflammation in the other arteries, and that can result in narrowing and loss of vision. So it is very important. Other symptoms which can be part of that is your joint pain and your achiness. So get it checked. It's very simple test we do beside doing biopsy, which is a confirmation, but you can do a blood test, SED rate, sedimentation rate, and if it's very high, that's a very simple, very cheap test. You get that done, and we see if there's a problem with a clinical picture, then of course we'll refer to or see the eye doctor.
Yes.
And it can really help save your vision.
Yes. It is rarely happens before age 50.
Yeah.
And is more common over age 70. Mm-hmm. Most of the people will come with headache. Even before they have a loss of vision.
Yeah.
So you have to suspect that, if some 70-year-old coming with a headache and we have a jaw pain when they're chewing, and then all of a sudden they lost the vision, you have your diagnosis even before any test.
Yeah.
But you have to have the biopsy. Biopsy is not always positive because you may not get the right piece. Yeah. But we know what it is. As Dr. Moby said, that if your SED is high or other inflammatory marker is high, then you have a diagnosis and you treat them with a steroid immediately.
Yeah.
And even before you have the diagnosis. But you can wait for immediately. You can wait for the biopsy almost 2 weeks or 3 weeks before doing a biopsy, because it is more important to treat, because you don't want to lose the vision in the other eyes, because then you'll be completely blind for the rest of your life. And so it's important that anybody who has a headache and vision loss, you should go to the doctor immediately, knowing that something bad happening and something needs to be stopped.
Okay. And the other thing for audience to know is that eye is such an important organ. It can really tell about your blood vessels. So when doctor looks or somebody looks at the retina, your blood vessels, we can really tell whether they're getting narrowing. So if you have high blood pressure, we'll see some narrowing going on there. Same stands for a lot of diabetes with we see already changes there. Same stands for any atherosclerosis, which is narrowing of the arteries, cholesterol deposit, and not to mention part of the brain is actually, you can tell if the pressure is too high and if they have any cancer or something else going on there, then that can tell doctor there's something wrong there, because it is connected. The flow can really affect there too. So a lot of things can be actually diagnosed by looking at somebody's eye. People don't know, but it tells doctor a lot of information.
To summarize.
Yes, let's do that.
Issue of low vision is issue of adapting. Like anything in life, you adapt things as it comes. It's a chronic disease, and you have to live with it. And how do you live with it? Mm-hmm. Make sure that your surroundings are safe. Mm-hmm. That's how you arrange things. Mm-hmm. You have to put extra light in the house so that it brightens up the room. Mm-hmm. You write in a block letter in a bigger way so that you can see.
Yeah.
And if you have trouble writing and not seeing, make sure that you get a lined paper with a bold line, mm-hmm. so that you can write in a straight line. Mm-hmm. You can see the bold line. Mm-hmm. And put a colored tape on the steps, mm-hmm. so that you can see with a change from one step to other. Mm-hmm. And You can put a motion sensors light all over the place so that as you walk in, you don't have to stumble and fall, and room is lighted already. And you can have audiobooks, which is available, and that will give you some education and also mental sanitation, mental well-being. And you can have a magnifying glasses to look at things. Then of course you have to see the doctor to make sure that they can fix the problems.
Yeah, and thank you for giving us great talk. And audience, please give us feedback, whether you like Twitter or Facebook, YouTube. Love to hear from you. Your questions, we'll be happy to entertain that. And keep us watching always. This is Dr. Moby checking out.
Thank you.